Within this video is the veterinary first aid treatments needed for treating a cat poisoning. Poison is a substance that can cause harmful effects to the body if ingested in significant amounts. Antidotes need to be provided to the patient as soon as possible to help counteract this poison. Animals can be poisoned by potentially toxic substances, including poisonous plants and toxic chemicals, including pesticide, paint, cleaning solutions, and drugs. Providing first aid can be beneficial to learn what rodenticide was ingested. Information of the poison can help the veterinary staff ensure the right treatment is provided. The commonly used rodenticides can induce fatal coagulopathies, meaning the blood's ability to coagulate is impaired through vitamin K deficiency. Spotting the symptoms as soon as possible will help to ensure the patient gets the treatment. The most common signs of poisoning is lethargy, inappetence, dysphonia, which is difficult breathing, collapsing, bleeding from the ear, and blood in the stool. Within the veterinary practice, the diagnosis of rodenticide is mainly made from the presumptive diagnosis made on the combination of symptoms and the laboratory test of abnormalities and the response to treatment. The patient may be distressed, primarily when being handled, so they must be safely restrained to help avoid further injury to the patient and the handler. A cat calming muzzle which covers the whole cat's face, including the eyes, can be used to help keep the patient calm. This can be beneficial when transporting them. Do not use if the cat is vomiting, as this can cause them to choke. Crushed cages are also beneficial as a form of transport. When handling a cat, ensure to place one hand over the back of the head with the other under the thorax and grasp the forelegs between the fingers. Lift into the handler's body as shown. This helps to ensure that the patient is held secure without the risk of them escaping and causing injury to themselves. When administering oral medicines, the patient needs to be in a sitting position with their head firmly held on either side of their neck. The person administering the oral medicine should approach from behind or the patient's side and take a firm hold of the upper jaw with one hand, gently pulling upwards and slightly backwards, causing the lower jaw to drop quickly for the medicine to be placed into the mouth. The medicine should be placed in the back of the tongue, close the mouth and massage the frontal area. Poisoning is an emergency, where often there is no time for laboratory investigations, as waiting can cause further harm. Treatments are considered in 3 stages: preventing further absorption of the poisoning, treating acute clinical signs, and providing supportive areas, and give specific antidotes. If first aid is provided within 4 hours of ingesting the poison, then inducing vomiting may be able to be a viable method. Such methods are providing 2 teaspoons of mustard in a cup of warm water, or 1 or 2 pea-sized crystals of washing soda, which are placed on the back of the tongue. Within the veterinary practice, a vet surgeon may also be able to use the medications to induce vomiting. Do not induce vomit if poison is known to be corrosive, as the tissues in the mouth and the pharynx will be burnt when the poison is regurgitated. If the patient is unconscious or having a fit, or if the poison was more than 4 hours ago. If it has been longer than 4 hours, then a gastric lavage may be needed, which washes the ingester from the stomach. This must be done under veterinary surgeons who will be under anesthesia or unconscious. Warm water or saline is introduced into the stomach via a stomach tube, where the stomach can be washed out until the drinking solution is clean. Treatment of the coagulopathy will also be needed. This can be done with doses of vitamin K1, starting with a dose of 2.5 mg per kilogram, then 0.25 to 2.5 mg per kilogram orally per day, for a minimum of 1 week to the maximum of 6 weeks. This will depend on the dose ingested. Critical care hospitalization for up to a week may be required to counteract the poison's long-lasting treatments. Observations will need to be made whilst the patient comes out of anesthetic, ensuring that they are placed in a calming environment, are provided with a heat source to dry their coat and keep them warm. It's important to ensure that it does not burn them and cause further injury. Here are the references used to gather the information used